Now, the cost of private health insurance goes up again on April 1 this week, with premiums rising by an average of 2.74%. It means families will be forking out an extra $127 on average a year. Singles will be paying an extra $60.
While the annual premium increase is lower than in previous years, it's the second jump in 6 months for many funds. And in the past 10 years, average premiums have crept up by more than 50%. Laura Croden from iSelect joins us now. Morning to you. This would have to be the worst possible timing for families.
Look, there's never a good time for a price increase, but the ongoing financial pressures due to COVID mean that many Aussie families are going to be looking closely at their cover and potentially looking to switch to a cheaper deal.
Yeah, when you consider the inflation rate is only 1 point something percent, sort of these rises are way out of whack with wage rises. Has the pandemic placed greater emphasis on having private health insurance? You're saying families will start to reassess, but gee, will that be a mistake?
Well, if 2020 taught us anything, it's that you can't put a value on your health. And as we've seen, public hospitals continue to come under pressure. Elective surgery wait times are continuing to blow out due to the COVID surgery backlog. The peace of mind and greater access to healthcare that private cover provides is arguably more valuable than ever.
Okay, you can still review your cover, and you've come up with 5 tips really that people should be looking at. Talk us through those.
Absolutely. So premiums don't rise until Thursday, so there's still time to shop around. Firstly, don't pay for things you don't need, particularly if your health needs or your life stage has changed, such as if you're an older couple still paying for pregnancy. If you think you're unlikely to be admitted into hospital in the future, opting for a higher excess can save families up to $350 a year off their premium.
Yeah, that's good.
Many funds offer discounts for paying by direct debit or your full fees up front for the year, and others offer freebies for things like no-gap dental checkups. Speaking of extras, if you're not using them, simply why pay for them? And finally, shop around. Many customers are able to save hundreds or even thousands of dollars a year by switching funds, and shopping around doesn't have to mean compromising your level of cover. Many customers are able to find a similar level of cover, but for a lower price with a different fund.
Yeah, it is great advice, and you really can cut your premiums. Laura, appreciate those tips. Thank you.
Yeah.
Thank you.